Poor working conditions, lack of drugs and equipment, delayed salaries and lack of NHIF cover for healthcare workers are just some of the challenges that healthcare workers face in the country.
But more worrying has not really been the fact that employees have not been employing doctors or health workers. What hurts is the deliberate removal of instruments that basically protect the right of health workers to be employed, to be trained, to be remunerated, and to be deployed and socially protected.
Earlier in the day, the Kenya Medical Practitioners, Pharmacists and Dentists Union KMPDU held a peaceful procession in Nairobi, starting off at the Ministry of Health offices, where they handed over their grievances to Health Cabinet Secretary Susan Nakumicha over the state of healthcare in the country.
That the issues that you have raised here are statements of fact. We are on the same page. So what you need to do is to allow us to go through these petitions. And you know that the stakeholders of healthcare is not just the Ministry of Health. We have many other stakeholders that I have to avail this document to. Then we come to a table, sit and discuss and provide a solution.
They then headed to COG offices to submit their demands to the council's chair, Anne Waiguru, considering that majority of health workers are under county governments.
So allow, therefore, that your leadership formally hands over the petition to us. We will receive it formally and convey it to the leadership of the Council of Governors.
The government cannot say they want to employ 1 million Kenyans when they can't employ just 4,000 doctors who have qualified amid shortage of 50,000 doctors in the country. It's a shame. And we won't allow it.
Shame.
It's a shame.
The medical practitioners, pharmacists and dentists working in the public and private sectors say that the challenges have led to a steady deterioration in the quality of healthcare services provided, further demanding for the implementation of the agreed collective bargain agreements within the shortest time possible, or else hold a countrywide strike.
Then all that will promulgate to the national strike that we cannot avoid in December if they don't implement the CBA, that we cannot avoid in December if they don't employ. We will not avoid that in December if they don't take the issues of having drugs and supplies in the hospitals. The unemployment is an issue that must be sorted.
It is evident that the health sector could be crippled even more if the grievances of health workers are not addressed as soon as possible, especially the poor working environment that they face as they try to save lives every single day. Robbie Omondi, K24, Nairobi.